A couple things you can do at home on your own, both from a nutritional and a activity basis. Nutrition-wise, we all know that calcium is very important for our bones, so it's important to get enough calcium in our diet and supplement with extra calcium when we don't get enough. We should be getting somewhere around 1,000 to 1,200 milligrams per day of calcium. When our body's deficient in calcium, we then take it from our bones, which obviously has a negative impact on our bones. So getting enough calcium would probably be the most important thing. Just as important, though, is getting enough vitamin D. Vitamin D is very important in the transportation of calcium to our bones. And most people in Iowa are deficient in vitamin D. It mostly comes from the sun, so most people need supplementation. And again, those are two labs that we check here during your bone health visit. Another thing is protein. Getting enough protein in your diet is important building block for bone, and we check a protein level as well. From a physical activity standpoint, any weight-bearing exercise is going to be most important for our bones. Even things just as simple as walking, putting that stress through your bones, stimulating them to be as strong as they can be is very important. Weightlifting, also important. Anything that would help strengthen your muscles, just think basically it would also help strengthen your bones. So those are some of the things you can do on your own at home. As a provider here in the Bone Health Clinic, there are also a variety of medications I use to help patients with osteoporosis to help strengthen bones as well. So medications for osteoporosis work in one of two ways. Our bones are constantly breaking down old bone and building up new bone in a recycling process. So the medications either slow down the bone breakdown process or speed up the buildup process. So one of the most common medications we use here in the Bone Health Clinic is called Prolia. That medication is in the anti-resorptive category, so it slows down that bone breakdown. It's an injection given into the arm every 6 months. After 5 of those injections, we do a repeat bone density scan, and then we're able to compare and essentially see what kind of improvements you're making in your bone density. Another great treatment option we have here in the Bone Health Clinic is called Evinity. It's a newer medication, and it actually works on both sides of the equation. It helps slow down that bone breakdown process and helps you build new bone as well. That's an injection given into the arm once a month for a year. Limitation with that being it's only approved for postmenopausal women and not for men yet. So there are a variety of things you as a patient and your provider can do to help in combating osteoporosis and improving your overall bone health.